This is Christine Porter with the Times News. I'm here today with dermatologist Dr. Stephen Schleicher to talk about shingles. How common is shingles?
Well, I mean, shingles is very common. It may affect up to 1 in 4 Americans during his or her lifetime. So that's a pretty big percentage of people who have shingles.
What age group is most likely to get shingles?
I mean, usually we say it's a condition that affects the elderly, and the older you are, the greater the chance that you'll get shingles.
Yeah.
However, it can certainly happen in pediatric patients and in teenagers and whatever. Sometimes we see it in individuals who are younger, who are immunosuppressed, who have certain diseases, but sometimes they're not, and they just get it. So, but by and large, it is a condition of the elderly.
If you've never had chickenpox, can you still get shingles? Because I understand it's related to the chickenpox virus.
Right. It's the same virus that causes chickenpox. And the thing is, in this country, 99% of the people have either had chickenpox or are vaccinated to chickenpox. A lot of people say, well, I never had chickenpox as a kid. Well, they did. They just didn't realize they had chickenpox because it's a very, very mild case of it. So, but theoretically, yes, you have to have had chickenpox or you have to have been vaccinated with the chickenpox vaccine.
When someone does get the shingles, what does that look like on their skin?
Well, shingles is basically a blistering disorder. Okay. So it can look like poison ivy.
Oh,
All right. From that standpoint, it usually starts out by being like a red patch. Okay. And then the red patch develop blisters. Now, people can complain of tingling or burning, okay, before they get the blisters. But a few days later, then when they get the blisters, then you know it's shingles.
and is it as itchy as chickenpox is?
Well, it's usually more hurting than chickenpox, but some people do complain of itching, but no, it's not as itchy as chickenpox.
So, what is the treatment for shingles?
Well, if you get shingles, okay, the earlier you treat it, by and large, the better. Okay, we use antiviral medication to treat it at its earlier stage. Sometimes we use steroids, okay, to minimize the inflammation. The whole thing with shingles is it does go away on its own.
Hmm.
But the problem with shingles is that about 10 or 12% of people will be left with severe pain.
And how long does it take from the time you realize, okay, yes, this is shingles to when it goes away for most people?
Well, for most people, shingles it'll crust over. Okay, so within 2 weeks, you'll just barely see some crusting. And then shortly after that, it usually heals without a trace.
Okay. Is it contagious like chickenpox is?
No, people can't catch shingles, okay, which is a good thing. However, if you ever encounter someone who never had chickenpox, they can get chickenpox from your shingles. It's
Oh,
very rare, but it can happen.
so who should get the shingles vaccine?
Well, it's generally recommended for individuals over 50,
Mhm.
okay, but it's definitely recommended if you have a family history of shingles, you definitely want to get the vaccine. And even if you've had shingles before, you can get it again. So you
Mhm.
definitely want to get the vaccine. And the newest vaccine on the market is better than the old one. So even if you had the old vaccine, it's still recommended that you get the new one, which is a two-shot. It's a two-shot vaccine.
How far apart are the shots given?
It can be anywhere from 2 to 6 months.
When you get your shingles vaccine, should you get it alone or can you get along with your flu vaccine or COVID vaccine?
Well, that's a great question. By and large, I mean, it's really important for everyone to get COVID vaccine. Okay, that's the number one thing you should get. After that, you want to get your flu vaccine because it's flu season. Okay, and then after that, if you haven't had a shingles vaccine and you're above 50, certainly if you're above 60, it'd be a good idea to get the shingles vaccine. By and large, if you get the COVID vaccine, you want to wait 2 weeks before getting another vaccine.
Does the blistering leave any permanent scarring?
Well, very rarely it can leave discoloration. Okay, I mean, but that's unlikely. Yeah, most of the time it heals without a trace. But in
Okay.
some people, yeah, they can get that. And usually the more severe it is, the greater the chance that it can leave, changes of your skin surface.
Hmm. And where do shingles typically occur at on your body?
Well, another good question. They can occur anywhere where you have nerves.
Oh,
Okay.
okay.
So since we have nerves everywhere, it can occur everywhere. The like on your scalp.
Mm-hmm.
Okay. The problem is that if it occurs by the eye, it can be a very serious condition.
Oh,
So if there's any chance of shingles being by your eyes, sometime even the tip of the nose, you definitely want to get to see a doctor right away. Okay, that's very important. But shingles can happen on your face, it can happen on your trunk. Very rare for it to happen on the legs, but it can. It can happen on the legs too. If you think you have shingles, by all means, get in to see a doctor. Because if you do start therapy earlier, the hope is that you won't develop this severe pain that can accompany shingles. And it can be so severe, it can be incapacitating.
thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.